Thank you. Good morning, everyone. Welcome to the Thursday, October 21st, 2021 Joint Boards of Health and Hospitals meeting. And I would like to call the meeting to order. So thank you everyone for attending, for our board members and for our guests. Thank you, and I hope you're having a great morning. I would like to first call a motion to approve the Zoom video to serve as the minutes from our last meeting from September 16th, 2021. May I have a motion to approve, please?
So moved.
Thank you.
Second.
Thank you. All votes for?
Aye.
Aye.
Any against? Wonderful, so moved. Thank you. We have a pretty brief agenda today, which is probably a good thing because we have Dr. Maddie in full force in week one. So we'll just get moving here. COVID-19 update, testing, vaccine, and distribution. Dr. Maddie, I believe you have
Yes, I do have some slides to share, and I will take just a brief 5 minutes just to start with some general comments. So please bear with me while I share screen. Can you see the screen?
No.
No. Can you see the slides?
Yes.
Mhm.
There.
Yes, it's coming up.
Yes, we can now.
You see it with this, with the notes or the?
Yeah.
The notes are visible, yes.
I never know how to do the full screen. Okay, does anyone know how to switch out?
I will go ahead.
Go to display settings and pull it down. You'll be able to switch. Or go ahead. Display settings on the top will allow you to switch.
I think you have two screens, so you switch to the other screen as your display screen.
Okay, I'm working, let me see.
Well, if you have two screens, turn one off.
Okay. Bear with me, so sorry, I'm new to all of this.
How many PhDs or doctors does it take to solve a problem? So,
Yeah.
Is that better?
Not yet, but if have you turned off your second screen?
Yes.
There you go.
Is that better?
Yes.
Okay. Thank you. I just wanted to start off by thanking everyone for your support over the last couple of weeks. The nature of how these things are done and rolled out can be very difficult. And I just want to thank everyone, especially Dr. Ballou and Dr. McBride, for their support and their patience. From the time that I was asked by the mayor to consider this position, I immediately reached out to Dr. Ballou, who has been an enormous support to me and has been advising. And unfortunately, both of us obviously had to operate in a way that was respectful of the fact that this is a position that is appointed at the pleasure of the mayor. And I just wanted to thank her and Dr. McBride for their support throughout this time. And I wanted to also take this opportunity to thank Dr. Eccles and acknowledge his leadership over the last couple of years and longer, even before he was in the position. He has been a force in the region, a longstanding servant and leader, trusted messenger and leader who has led the city throughout this pandemic and has led a truly remarkable department. I have taken some time to go on a listening tour prior to starting and have met with him and different heads of the department. And the thing that is most impressed upon me is the dedication that this department has towards the city. As we are all aware, people who work in public health are underpaid and overworked, and that is notably even more so in a pandemic of this nature. And so I'm extraordinarily proud of the work that they have done, and I'm so pleased to join them and to be able to work alongside Dr. Eccles. Dr. Eccles and I will be updating you at our next board meeting, but I just wanted to let everyone know that we have committed to a transition period where I'm doing more observation to allow him and all of the heads of the department to really just show me how things run, what their priorities are, and to consider that before making any large changes. Additionally, I just wanted to say that I did have a chance to meet with Dr. Ballou and with Dr. McBride, just to discuss what our priorities are. And we shared amongst those the importance of, in the coming weeks and months, reviewing governance for the Board of Health, to look to request a substantial charter evaluation and review. But most importantly, that we want to lead with equity and to start focusing on equity as central to the board and the health department's priorities moving forward in all that we do. So you can look forward to updates on that as we progress. I will now move forward to what I was actually asked to talk about on the agenda, which is the COVID-19 update, and have some slides, some brief slides for your consideration. So this first slide will be showing you the COVID-19 epidemic curve to date. You can see that it starts back from April 2020. And this gives us overall new daily cases. And as you can see, these have been decreasing since the summer wave. The 7-day average has decreased from a high of 62 on August 4th to fewer than 20 cases per day this week. Here we're looking at the COVID-19 percent positivity with PCR tests. So daily tests are now down over the last 2 weeks, but percent positivity has been steadily trending downward. For the summer wave, percent positivity peaked at 12.5% on the 23rd of July and is down to 5.1% as of October 16th. Percent positivity, just as a reminder here, is an indicator of the extent of community transmission. When percent positivity is very high, it indicates high transmission and or not enough testing is happening to detect the true case burden. So this next slide looks very busy, but I'll just walk us through it. It's the COVID-19 cases by zip code. And the map on the left shows raw case counts over the past 2 weeks, while the map on the right shows the rate per 100,000. So case counts are highest in South City, but when adjusting for population, we see that the zip codes near downtown and in North City have the highest rates. Overall, though, what's reassuring is that case counts are quite low. And this will be reflected in the next slide that I'm going to show you, that here we're going to look at COVID-19 cases month over month change. And the map shows the percent change of case counts for the past month compared to the month prior. Massive, massive reduction in case counts across the board here, as you can see. No clear pattern by geography, which indicates that transmission across the city has declined. So this is excellent news for our city and the region in general. So here we should, I want to draw your attention to the COVID-19 case demographics by race. And the major take home point here is that African Americans, as we have been saying, as Dr. Eccles has been bringing to our attention and made a priority during his administration, have been disproportionately affected throughout the course of the pandemic. And I just want to make some secondary points here in thinking about this from a timeline perspective. So African Americans had the highest burden early on in the first few waves. All races have been affected in the winter, and then the virus was rampant. But also special efforts were made, again, under the leadership of Dr. Eccles and the health department, to reach African American communities. Vaccine availability in the spring then caused a reduction in case counts, but African Americans' vaccination rates lagged behind, and thus the disproportionate distribution of cases returned in the February to May time that you can see here. African Americans since May have had the highest vaccination initiation rates and are closing the vaccination gap, reflected also in the case distribution. But African Americans still have an outsized burden of cases. I think this is very evident when you look at the way this is reflected in this graph here. Roughly 3/4 of all new cases in October can be attributed to African Americans. And so this will continue to be a focus of the health departments, and the reason why equity must be the priority for both the Board of Health and for the health department moving forward. Here we're looking at COVID-19 cases, case demographics by age. Children less than 20 years old have had a growing proportion of new cases. 10% of new cases were in age groups under 20 until January 2021, now up to 30% in children less than 12 who are still not eligible for the vaccine. Adults aged 20 to 39 have consistently had the most cases. This can be partially explained by their roles in the community, right? This makes sense. We're looking at highest risk jobs here, service industry, healthcare. Parents of young unvaccinated children who are now back in school are likely a contributing factor and more likely to engage in social activities than older adults in this demographic. So those three main points may be some of the reason why we've seen this consistently. But the good news here is that those at highest risk, 70 and above, have seen a marked decrease and make up very few cases these days, in part due to the highest rate of vaccination. And again, everyone on this board knows why this is. Dr. Eccles made this a focus of his leadership when the vaccine rollout started. And so that is excellent news, because at least the people that have highest risk factors have been protected, but we have a lot of work still to do. So when we talk about vaccine administration, there have been large spikes in vaccine doses administered, corresponding with the opening of eligibility tiers, according to the state's tiered systems. Vaccine rates fell off as quickly as it peaked, down to a plateau of 600 to 800 doses administered per day since June. And here I'm talking about first and second doses, now down to about 400 per day. That's almost a 50% drop off. Boosters were recommended for select high-risk groups that can be seen in the orange line. And vaccination rate for eligible population indicated that some individuals got their first dose but did not get their second dose. And this is the orange line that I was referring to. So when we now talk about neighborhood vaccination clinics, this map indicates location and number of doses administered in past neighborhood clinics. The circles are proportional to the number of doses administered. So the bigger the circle, the more the doses. And the dose counts range from 4,000 to about 3,000 here. Carpenter Halls, south of Forest Park, and the Omega City in North City have had the most doses administered, and the Department of Health outreach aims to bring the vaccine to where people are. Not included here are the doses administered to homebound individuals, which is another way that the department protects high-risk individuals. And then when we talk about vaccine dissemination by way of geographic distribution, southeastern zips have the highest vaccination rates, predominantly white and affluent, and zips in North City have the lowest. And again, here are the predominantly Black and less affluent. These zips in North City have also had the highest social vulnerability scores, including lack of access to transportation, higher rates of disability, and inability to take off work due to financial instability. And then when we look at this slide, the vaccination rate percent change over the last month, there's good news here, is that these same zip codes in North City also have the fastest growth in vaccination initiation rates, largely in part due to, again, efforts by the Department of Health. So if this continues, the gap will hopefully close over time. The exception to this is the zip code 63103, which has a low vaccination rate and also among the lowest rate of change. And so this may be an area that we will need to target more markedly. I will stop here and entertain any questions. Dr. Eccles is also available to discuss. And I just want to say that, again, a lot of the progress that you see is because of the efforts and leadership of Dr. Eccles in the health department. I believe that together we are even stronger moving forward. And Dr. Eccles and I are looking forward to continuing to update you with our plans for the department and the city at large. Thank you.
Thank you, Dr. Maddie. Do we have any questions or discussion about the updated COVID rates or COVID vaccine? Any questions?
Dr. Blue?
Yes. Doc.
Yeah, so if I could, and again, thanks to Dr. Eccles for all your service and continued service, and thanks, Dr. Maddie, for your excellent presentations, very thorough. I think the takeaway, and there was a lot of material in there to digest. One main takeaway is it comes back to one of the things you mentioned at the beginning. We can't take our foot off the accelerator on equity. You know, I don't know what slide number it was, but it was the one that had the case rates by race, which, you know, I found somewhat alarming that the proportion of African Americans in the case counts was up to 75% in the recent months, where the proportion of population, I believe, is about 50%. So that just shows you the disproportionality of that. And we all know, you know, the multiple causes of that, despite the great efforts of the Board of Health. So I think we just need to keep our foot on the accelerator. And I also think that it was, when you looked at that age graph, and I was staring at it pretty carefully, that children and young people are, you know, really where we need to focus. We've done quite well with older folks, I think, but people under 30. And especially now, if the news is right, we might be able to start vaccinating people under 12 pretty soon.
Agreed. And thank you for those comments and reflections. I think they're very, very indicative of these slides. I'd like to leave some time for Dr. Eccles to comment, because so much of this is reflective of work and priorities that he has been pushing throughout this pandemic. But I wanted to say that I couldn't agree with you more over equity. When we talk about vaccination and vaccination rates in Black and Brown communities, you know, there's two points here that I think are critical. Number one, increasing vaccine confidence and understanding that this is not a monolith, that it changes over time and the discussion and conversations change. You know, Dr. Eccles was talking to me about what he's been seeing, and I'll allow him to reflect on that when he speaks. I don't need to speak for him, but and additionally, what you said about children, this is a big focus for Dr. Eccles and I. We know that the EUA for children is being discussed, is being discussed with the FDA this week. We know that we will be beginning to roll out. Dr. Eccles has already laid the foundation for that in his tireless and consistent work in partnership with SLPS and other pediatric related organizations in the region. And so he and I will be focusing on a rollout plan there. I'll stop there, and I'd like to see if our great commissioner has anything to add. And hopefully I didn't embarrass him too much. I did okay for my first round, Dr. Eccles.
Amazing.
Thank you.
To Dr. Bondi's point, so, you know, we've done a lot of work with the primary and secondary academic institutions and school systems in the city of St. Louis to make sure they have access, because you know that our social vulnerability index and access for city of St. Louis residents is very different from outlying jurisdictions. And so we have to really go above and beyond to make sure we prioritize our most vulnerable population. So we've done a decent job doing that, I think, but we have a long way to go. So in addition to building confidence in the vaccine, we really have to also think about building confidence in the health system and government systems, because there's still a lot of distrust. And so as we engage communities in these more intimate settings, our focus is making sure that we take an opportunity to really explain the vaccine development process, as well as answer any questions they may have about components of the vaccine, side effects, safety, and effectiveness. Taking those simple steps really go a long way. And I think, you know, we have to, early on, a lot of the folks was just on reaching herd immunity. That's all we heard. But we forget about, these are people, right? So keeping in mind that we're serving people, not just numbers. They aren't numbers for us. These are lives that are depending on us to make the right decision and to really prioritize in a way that helps them achieve optimal health. And so that's really what our focus is, and has been, and will continue to be.
Yeah. Thank you so much, Dr. Eccles.
Question. Thanks. Really appreciate that response from both you and Dr. Davis and Dr. Eccles. Maddie, you showed the one slide, very gripping, showing the increased numbers of kids under 10. And I know there are concerns whether there will be vaccine hesitancy or lack of vaccine confidence in parents to administer this vaccine when it is available. So what are we doing proactively to prime the pump for these parents?
That's an excellent question. So this is a conversation Dr. Echols and I have had preemptively, both in the weeks preceding me starting and even this week. As I referred to briefly before, and I'll allow Dr. Echols to expand, Dr. Echols has already been laying the foundation from this, always being proactive, always being ready for the next step. And so this really great relationship that he's already developed for the health department with SLPS has been underway, conversations, and already an action plan in place. So the first thing is we do not want to jump the gun. We need time to review the data from the EUA and what is administered. A lot of times people want to get ahead of things and start talking, but then things go to the EUA and it's different from what we've seen. And we've seen that with the CDC over the pandemic. So while we are preparing those efforts behind the scene, laying the groundwork and making sure the infrastructure is strong, we in no terms want to get ahead with any definitive statements or definitive policies until we know for sure what will be happening there. However, there are facets that we should be working on right now. And those are two things, increasing vaccine confidence, like you said, because this is about a population that is young and cannot advocate for themselves. And many times it's about parents who are understandably afraid. As many of you know, I have a 5-year-old daughter and a 1.5-year-old daughter. So this is something I understand intimately because, you know, we've been waiting desperately for a way to be able to protect our kids. But at the same time, we do not want to put our kids in harm's way. And so Dr. Echols has been working with SLPS and other community partners who are affiliated to start talking about what vaccine confidence looks like, what is the appropriate language, how do we address that specifically, and what are the changes. So for me, I have been doing research with the CDC, and the COVID task force with the White House has representatives who deal with this specifically. They have been giving me advice and guidance that I will be sharing around what needs to be done. And I believe that this has to have a three-pronged approach. Number one, to be looking at the school systems. I will be meeting with the leadership of all the schools systems within the city of St. Louis, but also inviting community leaders to that discussion who are affiliated with pediatrics, and then pediatricians within the regions, both within our hospitals, but also in the community setting, to have a combined discussion about what they anticipate to be challenges and how the health department can help them with that. The second aspect that I'm really focused on is access. We've seen that to be a challenge with adults. It will continue to be a challenge with children. And so Dr. Echols has been very focused on what will a rollout look like if we get to that point and if the data is sound from the meeting. And I'll pause here and allow Dr. Echols to speak a little bit about what he has been working on to this point and what our work ahead will look like as well.
Yes, so thanks, Dr. Marty. So our primary focus has been increasing vaccine uptake amongst those who are currently eligible in our school systems. We still know that, as Dr. Marty mentioned, there's the parents are the gatekeepers for this population. And so one of the things that we're working on with SLPS in particular is a communication plan that informs parents about not only the safety and effectiveness of the COVID-19 vaccines that are available, but also the advantages of getting vaccinated. So one of the challenges with SLPS students is, you know, those who have to quarantine. In some cases, we've had students who had to quarantine for 2 and 3 times. And so that's, 14 days each quarantine. So that's, a month and a half for some students. And that really sets them back scholastically. As we know that over the last year, all the school systems have been, not only in the city of St. Louis, but across the nation, have been set back due to lack of proper platforms for virtual learning and lack of support and so forth in some of the homes, particularly for our most vulnerable students. So informing parents on the safety and the effectiveness of the vaccine, as well as making sure that they understand the advantages. And one of the great advantages is uninterrupted learning. So being able to keep children in school even if they are exposed to a COVID positive person, will really help a lot, not only for students, but also staff. So that some of the school systems have adopted mandatory vaccination policies, and SLPS of their vaccination rate at this point amongst staff is 97 to 100%, which is I think the highest in the region at this point because of the efforts that Dr. Adams took to protect not only the staff but the students. And so working more closely with the parents is going to be really critical, but also making sure that we work with all the platforms that are able to get information out to not only those who use traditional media outlets, but those who may not have access to traditional media, such as in those who are typically in our most vulnerable neighborhoods.
Thanks. This is all very commendable.
Thank you so much, Dr. Ross.
I have a brief comment. So for some of you that don't know, Dr. Eccles and I've been working pretty closely on a HRSA funded project. Oh, I'm sorry. I saw Sue have her hand raised. Please.
Well, go ahead and finish and I'll go after you. Thank you.
Okay, sorry, I did not see your raised hand.
Thank you.
And we have been working with Better Family Life and other community partners and UMSL School of Nursing to vaccinate, to develop vaccination campaigns, and Dr. Eccles is coordinating the vaccinations. Been participating in some education that's primarily focused on African Americans in the Promise Zone and the Page Corridor area, some of the lowest vaccinated and highest case count. So the team, we with the assistance of Dr. Eccles and some of my colleagues who have been on the forefront of COVID vaccine contact tracing and vaccine communication education for communities of color. We have actually a website and a whole training that's focused on vaccine communication and for African Americans that was developed based on focus groups and things in St. Louis. So it has just facts, it has things about African Americans that were involved in the vaccine development process, and all information on the different vaccines and the effect of the vaccines, how many African Americans were in the trial. So we have some information on that, and we're continuing to add. The next step would be to add, to really focus on the research and the data that's coming out for children. So we're kind of about to start pounding the pavement and going door to door and doing some vaccine events in the African American community in North City. But we do have some resources that we've developed over the past few months, if anybody is interested. And we are doing another training on COVID vaccine communication. It's focused on African American communities, first week of November. And thank you to Dr. Eccles for being the one who's provided some clinical advice and also who's coordinating with the pandemic response team to come out to different African American focused community events to be able to offer the vaccine.
Yeah, and I just wanted to add, first of all, thank you for all the great work that's been done, and especially thank you for the prudent approach of waiting until the information comes out before we get ahead of ourselves and dismantle that trust. I just wanted to make a suggestion, because I'm hearing a lot about working with physicians or with pediatricians in schools, which obviously makes the most sense with children. But as a women's health provider, many times when women come in, after they have spoken to all those other people, they come in and they talk to their women's health provider, whether that be a family practice person, an OBGYN, whatever. And particularly with all of the sort of disinformation swirling around fertility implications. So as we are planning this rollout and addressing children's issues, I would just recommend that we also include that group so that we have aligned messaging and people are not getting even a little bit different messaging from different providers, because that could also dismantle trust.
Thank you so much for those comments, Susan. I couldn't agree with you more. One of the frustrations for me has been the traditional approach to what a provider is within medicine. It is antiquated and lacks an equitable approach. And I believe you're absolutely right that we should be focusing on a wider definition that is inclusive and reflective of the trusted messengers that people go to for this advice. That happens oftentimes in the groups that you stated, in family medicine, people who focus on this, but also in our nurse practitioner populations, our nurses as well. And we need to make sure that there's leadership. I've actually got a meeting with some of the nursing leadership within the region around these very conversations to make sure they're included. We often even forget our pharmacists. They are the front line as far as information that people go to for these types of things. So, I thank you for that suggestion. I'll definitely add it to the agenda for the discussion Dr. Eccles and I are going to be having around this topic. And, as I come on, there's a lot of mapping. My department, I asked them to bear with me because I'm a very visual person and I believe in having organized, infrastructure to be able to know what our systems are like. So we're doing a lot of mapping of who are all of the FQHCs in the region, community groups, and I'm doing the same for schools to make sure that there's no holes or people that we've left out. And I think because of your suggestion, it would be prudent to do the same for our providers so that for that meeting I was telling you about where I'd like to bring all stakeholders to the table, teachers, providers, and community leaders, that we make sure that we've expanded that definition. We have mapped those groups out. We bring everyone to the table and make sure there's an inclusive approach to what they're seeing and what they'd like to see from us. So thank you for that.
Thank you. Do we have any more comments or questions? All right, thank you, Dr. Maddie, for the updates. Much appreciated. Now we will move to board committee reports. So the governance committee, please.
Good morning, everyone. On behalf of the Governance and Nominations Committee, I wanted to just update you on our process for filling the one open board seat that we will have in 2022. So we have one open seat. We have 4 outstanding nominees that you all have submitted to us and that we have in the pipeline. The committee is in the process of conducting one-on-one interviews with each of these candidates. We'll conclude those interviews in a very short time frame within the next few weeks, and then we will meet together as a committee with Dr. Ballou, and we hope to come with you with a recommendation for our November meeting for a discussion. And I believe our bylaws will require us to take a vote in either November or December. I'll have to check the exact timeline and protocols for voting on confirming a new board member. We only have one open seat for 2022. We do have more board members with their terms expiring in 2023. So we will have possibly more board seats opening up then if there are other candidates you have in mind that you'd like to bring forward, or if we have any of these 4 nominees that we find very attractive and that we may want to reconsider in the following year. So we're delighted to have a great pipeline right now of terrific candidates. And so stay tuned, and more in November.
Thank you. Linda, any questions or comments? All right, thank you.
Just run real quick question.
Sure.
The opening is the opening Dr. Maddie's seat, or what's the opening?
Yes, the opening is Dr. Maddie's seat.
Okay, that's what I thought. Thanks.
Okay.
And next we have the Academic Public Health Collaborations Committee, and I believe you have a report out on a really successful conference last week.
Thank you, Dr. Ballou. Yes, the partnerships have been very active, and in particular, the academic health department. So yes, Region 7, where we had Kansas, Nebraska, and Missouri all reporting out over 3 days, Wednesday, Thursday, Friday. I hope some of the board members were able to participate in that. In addition to that, the academic health department is actively working with the Department of Health on a workforce development plan, which is so important and part of our accreditation and also part of our work in terms of that creation of pipelines for our professionals, as well as that learning environment for the Department of Health. I was reflecting as there was the discussion about some of the areas of the promise zone with regard to vaccinations, that early on we had an opportunity for some qualitative data with a report with Dr. Ray, you may recall, and St. Louis County and St. Louis City, where we had 65 individuals in focus groups giving us some information on some things that we might consider moving forward in terms of some of those communications to relieve some of the hesitancy and build up some of that confidence. There are some efforts moving forward. There's an outstanding research project with SLU in the area of violence prevention that was developed through our partners at the Violence Prevention Commission, looking at mental health for police officers and also community-oriented policing with problem solving in the community, and trying to look at what some of those things would be that would be helpful, and those things that would be barriers with regard to implementing some of those areas. Also, Dr. Moshe and Rhonda Bartow have requested a project with regard to equity based on the baseline report that the city had back in 2018, developed by Christina Garmendia. This would allow us to develop a report that could be actionable with the Department of Health taking that role as chief health strategist to monitor and push a few focused areas with regard to equity, and particularly racial equity, obviously. And then most recently, I know Dr. Ross, we had met with Audrey Kuhlman prior to the, I almost said the academic, but the epidemic. And so there was a presentation this past Monday to 125, I believe it is, medical students at Washington University with regard to the CHIP and the CHA within the region. And there were some more specific presentations with regard to recast resiliency in communities after stress and trauma, which has been a St. Louis County grant that the Department of Health has played a major role in, along with St. Louis Mental Health Board and others. And also the healthy homes in terms of some of those specifics in the social and structural determinants of health. That happened to be the first all staff meeting that Dr. Maddie had, and so I had to jump on and off with regard to that, but we were able to complete that presentation as well. And so they got to see how we mobilize action for planning and partnership as part of that presentation, and look forward to other opportunities like that as well. I think that currently is the completion of my report for the time being. Thank you.
Thank you, Craig. Any questions or comments? All right, Communications Committee, please.
Good morning. Thank you, Dr. Blue. We have not met formally, but we have been communicating via email to identify ways to increase response to the Citizen Health Priorities Survey, which will help us figure out which 2 additional health areas the public information staff and the agency, STLTV, should communicate on beginning in a few months. So far, I do not believe we've had a large response. Serena Muhammad suggested several places we could partner with Essence in the Neighborhood Specialization Office. The Water Division or Refuse can put leaflets inside of bills that will give people direction to our website to respond digitally. And we also need to make available via print for people who don't have digital connections, the survey. I was unable to join the weekly public information huddle with the agency yesterday, but Harold, do you know if the response rate has increased? And I think also I read one email that we are trying to include that information about the survey and the tax bills going out at the end of the year.
We still have a slow turn-in rate for the survey, and we are planning to have the information in the tax records to go out next month. So we're trying to get a quote. It has to go outside of the city for a quote, but we do plan to get that done.
We still also have the Health and Human Services Department, I think that's what it's called, on the Board of Aldermen, interested in partnering with us in, at least verbally, Dr. Blue, I don't know what kind of other commitment we have to make sure people in their audience and in their wards can respond to the survey. And then secondly, we want to have them help us recruit and conduct focus groups in each of their wards to discuss the priorities and responses that we get on the survey after the survey is tabulated. I'm not sure about the timing of this, but I think this will be a focus of our committee. We wanted to hold up to have a conversation with Dr. Maddie and Dr. Eccles after this meeting about the survey, because we know it's important, but we also know that the other issues, the pandemic response and the vaccination of young children are, even more important than that. So we're looking for a little more direction, but I've been on the weekly huddle calls with the agency, just putting in, my questions about, communication priorities and STL TV has been doing an excellent job keeping the ball moving and getting communication out. But I think we need to enlarge the committee circle and have some discussion in the next month about how we can help with the survey and any other priorities that Dr. Maddie, Dr. Eccles see we need to focus on going forward for the rest of this year, the calendar year anyway.
From recent emails, the chair of that committee would like to have some discussions about some specific next steps with Dr. Eccles and Dr. Maddie about how to really engage the Board of Alders and being able to increase the response rate for that survey and to help with communication for the health department in general. So I will send an email.
Thank you.
Any other questions or comments about our communications committee report?
Nothing. I would like to see a copy of that that survey. I mean, if you can share that with the board so we can just see what's on that Citizens Health Priority Survey, just an FYI.
Okay.
Dr. Ross, I can put the link in the chat.
Okay, that would be great.
And we can send the printed copy. The document is just a Word a printed version of the survey, so I can send that to the board.
I say that because of next week, Washington University will host their annual Institute for Public Health conference, and we're going to be talking about just that. I mean, how are we taking community input and really structuring a plan that's cohesive, that's collaborative, inclusive of the health departments, hospital systems, academic medical systems, centers rather. And it will be nice to know that we are continuing to gather that data. So I'd like to see exactly what the survey instrument looks like. Thanks.
I think I've made this suggestion before, and I don't know, it may be kind of a point of no return, but we have several surveys out from different departments of the city. And sometimes it's difficult to promote one over the other. So I wonder if there's an opportunity to think about kind of a central point of these are all of the surveys that we're trying to ask citizens to weigh in on so that people don't get confused. For violence prevention, we have some specific surveys that we're promoting. We've actually been talking to the St. Louis Public Library about assisting and distributing some of that information. So we have some avenues to get information in front of people, but I don't know that the coordination is happening internally with all of the different survey activity for the city of St. Louis.
Oh, absolutely agree with Serena. Yes.
Serena, are the surveys you're talking about all inclusive of public health issues? I know violence.
That's a part of them. There are different surveys, so I'm not suggesting that we only have one, but I'm suggesting that as we're communicating to people, they have a better understanding of these are the 5 things that the city is trying to learn. Here are the links to access those surveys. So the one on violence prevention is specifically about how people perceive and experience violence. But the public health survey has questions about violence. And then there could be other surveying happening in other departments. So if there is, one of the things that the mayor's office has talked about is having some ongoing or bi-directional feedback. So if there's a place on the city's website where we're very clear, these are the things that we're trying to learn or we want to hear from you about over the next year, and the links for all of the surveys are there, people can kind of browse and opt into the ones they want to take, the ones that they're interested in, they can help promote them. But something that the city maintains that kind of catalogs the information that they're seeking from the public, because right now every department is trying to get their own kind of foothold and strategy, which you may just maximize your presence and visibility if there was more of a coordinated effort.
That could be a good discussion with the committee on the Board of Aldermen as we try to talk with them. But that makes a lot of sense what you're saying. I know there's a lot of survey fatigue, and it's also a challenge to reach all of our citizens, a real cross section in our city.
It also sounds like a opportunity to kind of coordinate and how surveys, like the queuing for surveys internally in the department as well, and how that will be done, and then kind of the external part about getting a good response rate.
Each week, the communications team staff from different agencies meet with the mayor's office. So I think this is something that we can relay up to the mayor's office, so they can be the ones to really catalog that, because it's because there are multiple agencies that fall under the leadership of the mayor's office. So we can make sure that's a point of discussion for that group next week.
Great idea. Thank you.
That would be excellent. Dr. Eccles, coordinated, because I'm assuming that other agencies in the city, other government agencies are having similar problems, and that that the citizens don't know which surveys are coming from which department and are becoming fatigued. So there could be kind of a united effort across city agencies about sending out surveys so that there's no fatigue or burnout or frustration or duplication of efforts as well.
Yeah, and I'll just to illuminate the point a little further, just in violence prevention, there were 8 different entities about to do surveys about around the same time. So one of the things that we did with the Violence Prevention Commission was to try to have a meeting, an evaluation meeting of everybody who's doing a survey, what they're trying to learn, who they're trying to reach, what their timeline is, so that we could streamline that. But that's just on one issue. And I suspect that there are probably other issues or departments where they're getting requests from community members and institutional partners. So it's not solely the city itself, but as they're working with partners, these issues kind of multiply as well. So having that conversation, I think, could help across multiple fronts.
Thank you. Are there any other comments or questions about that? All right. So our next agenda item, any departmental updates? Dr. Maddie?
Yes, thank you. I'm going to provide some departmental updates, and I'm going to go through the different departments, and then I'll give Dr. Eccles an opportunity to comment on anything that he also feels is necessary. So from our public information officers, who are Harold Bailey and Kimberly Vanderberg. So the Roll Up Your Sleeve campaign continues. We've transitioned from COVID-19 only messaging to respiratory illness messaging. As you know, that's critical right now as we're entering the winter season. So we'll be doing a lot of focus on flu vaccines and other respiratory illness related messaging. Transit ads are up. On bus and train shelters, billboards throughout the neighborhoods are up, radio and digital spots are running, and geofencing to target zip codes will be conducted. We've had some discussion in the community survey, so I'll leave that off because everything has already been discussed. for communicable disease and women, children, and adolescent health. So the CARS project so we're wrapping up the culturally responsive services series. The series was created to equip healthcare professionals as it relates to caring for Black men and their sexual health. This has gained a lot of traction, actually. The state has reached out to us to implement the series in training of new and current staff. And the purpose of this grant is to reduce sexually transmitted infections amongst Black men 18 to 29, who you all know are of high risk. For Fast Track Cities, St. Louis, both Fonda and I have transitioned out as co-chairs. Terms are ending. We will have a City of St. Louis Department of Health rep, and we'll continue to keep you posted. The new co-chairs, Dr. Corey Bladley and Darius Rucker, are incredible, reflect this community very well, and have started the charge. So we're very excited about that and continue to support them. For the Women, Children, and Adolescent Health, the MCH team has submitted the resiliency booklet for final review and approval. This booklet was created by the team with assistance from our EPI and interns, and it will serve as an accumulation of our 3-year project focused on resiliency in the city of St. Louis. The resource includes information about the causes and effect of trauma, both physical and mental, with prevention strategies and community resources should families experience a traumatic experience. The LEAD team will be participating in the first annual LEAD Summit that was organized by Healthy Blue on Friday. And then the school health is focused on completing immunization audits and preparing the CD31 report to the state. The Men's Health Series debut is scheduled for, has been scheduled. And has this already happened, Fonda, in partnership with the American Lung Association?
Yes, we had the first one. So
okay, and so that already went, and any comments about how that went?
Yeah, it went pretty well. Candice, do you want to speak a little further about it?
Sure. Good morning, everyone. So our PIOs have built a phenomenal page for this Men's Health series. It went really well. We are doing the other series, which is coming up on stress management. So always in the vein of continuous quality improvement and looking to elevate the lived experience of men in the community as being champions in terms of achieving optimal health. So good first start, but certainly looking to improve and to get other content experts to optimize health in the male population.
Thank you so much, Candice. I'll move on to HIV surveillance. We completed a validation study, and for HIV prevention, we've been securing trainings on phlebotomy, state CTR classes, in person from the 19th to the 22nd of this month, state harm reduction, and cleared training. We also have a put a ring on it initiative, AKA internal condom, formerly known as the FC2 female condom plan, and that is underway. For our perinatal Hep B, we continue tracking four cases for pregnancies and infants and re-engaging pediatric clinics. And then as far as TB and refugee help, we started administering COVID-19 vaccines to refugees at the International Institute. We've seen an increase in refugees from Afghanistan with 45 in the past month. And so that's a big area of focus as far as making sure they have access to not only the vaccine, but services in general. And we have some updating events, some events in October around Healthy Lung Month, and as well as activities to honor Breast Cancer Awareness Month. And then as far as environmental health services, we have upcoming vaccine clinics at True Light Church and Gregory J. Carter Park. The emergency preparedness team is updating booster doses to reflect newly released guidelines, and PPE distribution and Clergy Coalition care kit distribution is still underway. As far as EHS priorities, I think it's important to note that we have to fill a lot of vacancies. 7, I repeat 7, in animal care and control, 2 in food inspectors, 1 in community sanitation inspector, 1 in pest control workers, community sanitation, emergency preparedness, and environmental health services manager. I think it's important for me to bring that up because in my listening tour, one of the priorities that we hear about is just how burnt out and how much staff we've lost during the pandemic. Most of our staff here do the job of 2 to 3, 4 people sometimes. They're doing it extra hours, they're doing it on the weekends. So the excellent work you hear from here also reflects additional work that everyone has had to do here. And so one of my priorities before, everyone wants to hear about what I want to do in the community. It starts with what's happening internally and making sure that we not only have adequate staff, but that we are valuing our staff and making sure that they are supported, especially with behavioral health and mental and wellness initiatives that I will be talking to you about later on this year as well. We're continuing transition from the health space platform to the City Works for electronic workflow management and monitoring staff for and mitigating against increased stress and burnout resulting from the aggressive work tempo during the COVID-19 response that I just discussed with you. Dr. Eccles, did you have any other comments on departmental updates?
Just have two couple of events. So one is we have an RFP out for COVID-19 community engagement and canvassing. So I believe it comes down next week. So we encourage individuals to apply for that. And we also have a special project that we launched earlier this year with Christian Hospital. So they started their HIV opt-out testing a couple of months ago. During the month of September, they screened over 1,100 individuals and roughly 10 individuals were connected to HIV care. And so lots of great work that's being done, but also to Dr. Mahdi's point, so the personnel issue is something that is impacting the health department. And so over the course of the pandemic, we've been able to attract really great talent, but due to the pay structure in the city of St. Louis, we have had really a lot of difficulty keeping that talent on board. And so I know that there's some efforts that are underway to look closely into that issue, but that will continue to be an issue for the city of St. Louis Department of Health and other city agencies moving forward if it's not addressed.
I'll take any questions about the departmental updates.
Sure, I have a question. Your comments about the vacancies, particularly in environmental health and others, reminded me of this. At some point, would love to get an update on the funding coming from the mayor's office, from the prior federal funds, stimulus money and others. How I know the amount that was mentioned. I wanted to see how much has been allocated, the time frame for allocation, and any constraints on how that money will be spent. I know you don't have that information now, but I think that would be really pressing to. I think that's pressing to me to know what's happening in that area.
Dr. Ross, always on point and gets to the heart of the issue. So this has been a pressing concern of mine as well. I started these discussions prior to my start a month ago and have been in continued discussion with the mayor's office. Dr. Eccles can only work with what he has. And so he has worked tirelessly to make sure that the health and the wellness of this department is intact, but he has limited and has had, prior to me coming on, limited ability to control pay structure and the ability to even bring people on. So I want to give you an example. It takes us right now 6 months from the time that we're able to post to the time that we're able to bring someone in for a vacancy. We're also limited due to the legislative process as to how we post for those vacancies. This makes it very difficult in an already strained and underworked environment to get things through. Additionally, like you are alluding to, Dr. Ross, salaries are not as competitive. This is true across the country. This is a problem within local health departments, but I've been in discussion with the mayor's office, and there's currently a survey around equitable pay that we have been told we will get the result of for city workers across all departments. With that, we are hoping to see some change around equitable pay structures across the city. But in the meantime, I would be happy to discuss with Dr. Ballou putting the budget questions that you provided on the next agenda. And Dr. Eccles and I can address that in more detail with the board, because I do believe this must be the priority. I can't even start working on equity if I don't have staff that can do this work. And if they aren't doing so in a way that takes care of not only their financial wellness, but all parts of their wellness. Dr. Ross, can you please do me a favor, and when you get a chance, could you send me an email with the targeted questions you'd like to see for my consideration? And then Dr. Ballou and I will discuss if this is an appropriate topic for a more pointed presentation at the next meeting. But thank you for bringing that up.
Thank you very much.
All right, thank you. Any more comments or questions about the departmental updates? Great. Any
I had a
old
question.
business? Oh, yes, please.
Sorry, I had a question, Dr. Ballou. I was very interested in the work that you described about women, children, and trauma and the booklet that you are putting together. My question is, what are your plans for disseminating the booklet? And will there be any kind of an online version that will be available on the department's website?
Thanks so much, Linda. Candace has been leading this, has done incredible work including members of her team with this. So I'll allow Candace to address that question. Candace?
Certainly. Thank you for that question. And absolutely. So we will make available on our website the booklet, but also we're printing a small quantity for dissemination. I've been speaking with my nurse as to who this could go out to. So she has been really connected even with the providers who essentially do this work. We're finding some challenges that they may not want this on their website per se, because they may have contracts with other providers. However, what we want to do is get it out broadly as possible. So it will be on our website. We will, of course, share it. I believe it's complete. It's been blessed for approval. And so it also includes some really great numbers on how the work that our maternal child health team working on the Title V priority health issue, but also taking into consideration some of the metrics with case management for cure violence. So it really gives a very nice holistic view of how we have been addressing gun violence on families that have been impacted by trauma. And if there are other ideas for dissemination, of course, we welcome that. But yes, to the best of my knowledge, it will be posted on the DOH website. And we are printing copies of that resource as well for dissemination throughout the community. Our nurse has phenomenal relationships in the 3 target neighborhoods. So again, making those available at community outreach events, but connecting with the older persons for those wards, I think is also another great avenue to get the resource out. Thank you.
Thank you, that's very helpful.
Thank you so much, Candace. And again, thank you for your tireless leadership and the work of your team. I have just been so impressed by all the work that you and other members of the department have been doing. Dr. McBride, I think has a question.
Yeah, real quick, just to add to your comments about labor shortages. I serve on the St. Louis County Justice Services Board for the jail. And you may have read about it in the paper some. We have had a really severe shortage of labor for both corrections officers, and now actually they partly resolved that by the county raising the pay for the corrections officers, and we're still behind other counties. And we now have, I will tell you, it's probably not been talked about much in the paper, but it's in our minutes. We have a pretty big shortage in health workers at the county health department, and that's going to be your next problem we're dealing with. And so it just speaks to a labor shortage. I'm an economist, that you don't have to pick up the paper much these days to read about labor shortages and rising wages. And the point you made about wages and pressures going on in the COVID during the pandemic is a big problem. And the problem that we've been talking about at the county health jail is that when you have labor shortages, it leads to overtime, and it leads to stress among the workers, and sometimes can lead to unfortunate consequences. And I think that's something that needs to be brought up to the leadership.
Couldn't agree more. And thank you so much for that, Dr. McBride. I did want to make one last announcement. During my listening tour prior to starting with the health department, I did meet with Dr. Faisal Khan at the county, and I did ask for a monthly meeting of our 2 leadership teams and the leadership of both of our Board of Health. I believe this will be important for us to strengthen the region, for us to collaborate, for us to share resources. And even when we are not doing the same work, to keep up awareness of what both areas are doing. I'm so pleased with this development. They have committed to that, and we will now be meeting monthly with them. We have secured our calendars for that, and I'll be able to give you updates on those monthly meetings. So from our end, obviously, that will be myself, Dr. Eccles, Dr. Ballou, and Dr. McBride. I want to thank Dr. Khan for his willingness to do this, and I'm very excited to see what can come out of this this joint leadership approach and this collaborative approach to our region. Thank you so much.
Wonderful. Thank you, Dr. Maddie. Any other comments or questions about updates? All right, any old business? Okay. All right, announcements. Our next meeting will be November 18th at 8 a.m. And next week, there's a board luncheon at the Washington University Public Health Institute Annual Conference, October 27th at noon. All the board members did receive an invite to that a couple weeks ago. And if your RSVP status has changed, please let me know, or me and Dr. McBride know, so we can update that, because Dr. McBride's team has graciously provided lunches and coordinated the rooms. And so we are grateful for that. And so please let us know so that they can make adjustments. So if there are no other questions or comments, I will ask that we have a movement to adjourn.
So moved.
Thank you, Dr. Ross.
Second.
All right.
Second.
Thank you. All in favor?
Aye.
Aye.
Any opposed? All right. Thank you so much, everyone, for attending, and be well and safe until our next meeting in November. Thank you, everyone.
Thank you, everybody.
Bye-bye.
Thank you.